Hey everybody, Colin Teske here with Senior Market Solutions. I just wanted to talk briefly with you today regarding the Medicare Part D late enrollment penalty. It's something that really is probably one of the most frustrating things that people run into with Medicare. You turn 65, you get on Medicare, you get Part A, Part B in place, a Medicare supplement, and then a lot of people either miss it or decide that it's not financially worth it at 65 to take a Part D plan, so they skip it. And then as a result, later on, when you go to enroll in a Part D plan, you are a penalty is added to your total cost. And so let's talk about how you can avoid that and some other options that might help. So let's go over here to the Part D enrollment penalty form on Medicare.gov. If we take a look right here, it talks about how Medicare calculates the penalty. I'll zoom in here for you. Medicare calculates the penalty by multiplying 1% of the national-based beneficiary premium. So what that means is you have to pay 1% of the national-based premium per month that you miss being a part of a Part D plan. So let's say you skip the first 4 years of being on Medicare because you're in good health and you don't have many medications. That's 48 months. That's 48% of the national base premium for Part D plans. And you may think, if you look at all the plans, there are some cheap ones out there for less than $20 a month, but it's not 1% of those, it's 1% of the total amount, or the average amount. So if you take a look here, in 2016, it was, or is, $34.10. So you're going to pay 50% of that after 4 years every month. And then the other thing too is, if you, let's say you avoid taking a Part D plan when you first enroll in Medicare, once you get outside of the eligible window, which let's take a look up here, you can enroll basically 3 months prior to your 65th birthday or 3 months after. If you don't enroll in the Part D plan during that time, you cannot apply for a prescription drug plan until January of the following year. So if you need medications during that time, you won't have coverage. So the other thing too, though, to keep in mind is if you do wait to enroll in Medicare, you can dispute that. You can dispute that penalty. We have helped people with that. So if you have employee coverage or the VA, which is credible coverage, we can help you dispute that penalty, and you can read about that down here. So let's take a look at an example of that. So it says here, Mrs. Martinez is currently eligible for Medicare, and her initial enrollment period ended on May 31st. She doesn't have a prescription drug coverage from any other source. She didn't join by May 31st, and instead joined during the open enrollment period that ended in December 7th, 2014. Her drug coverage was effective January 1st, 2015. So, since she was without credible coverage, prescription drug coverage from June 2012 to December 2014, her penalty in 2015 was 31%. That's 1% for each of the 31 months of the $33, the national base beneficiary premium for 2015, or $10.27. Since the monthly premium is always rounded to the nearest 10 cents, she paid $10.30 each month in addition to her plan's monthly premium. So here's the math. 31 times 33.13, which is the base premium, is $10.27. So, so here's the gist. If she would have simply taken the lowest prescription drug plan out there with the least coverage, even though she didn't need it, in the long run, it would have been a better financial choice for her. And so that's something we always encourage people. Do not avoid prescription drug plans if you don't need the prescription drugs. There's better plans out there. You really need to think about the long-term cost of being without one. And there are plans out there provided by private companies as well as most states that offer very low monthly premium costs. So give us a call here if you have any questions regarding the prescription drug plans, if your drugs are covered, what the costs are, if you want to dispute any of that. We're available and here to help. Number is 1-800-784-8969 or click the link below. Thank you.